Welcome back to Shape of the City. Finding affordable mental and physical health care can be a real challenge for those most in need. Two local nonprofit organizations have come together in one location to give those patients a fighting chance. Shirley Terry from Lutheran Family Services and Brad Meyer from People's Health Center will tell us more about the Health 360 Integrated Care Clinic. Thank you both for coming today.
Thank you for having us.
Well, now let's get started. Tell us what Health 360 is about and what services are currently provided there.
Health 360 is an integrated care clinic, meaning that it provides physical and mental health under one location. It's a full-service primary care clinic.
Okay. When you say full service, what types of services specifically could somebody get there?
We will have 3 providers there. One is a physician, and then we'll have nurse practitioners there. Anyone is welcome to come. It's a doctor's office, and along with getting their primary care, they can also get their behavioral health care needs met.
Okay, very good. How does the partnership work? How is this truly unique for Lincoln?
Well, it's unique in Lincoln is that we have 2 nonprofits coming together under one roof, 2 different cultures, 2 different kind of mindsets. You know, Lutheran Family Services has been doing behavioral health for eons. People's Health Center has been around for almost 13 years doing primary care. And so we've just kind of partnered up to do just give our patients a better experience when they go to the doc. And so it's not one size fits all. We're still learning. We're still trying to figure out what is best for our patients, what are the needs of the patients. So we've added some services. We've kind of, it's kind of a slinky effect. You know, you stretch out thinking you're going to do all this, and then you come back in knowing that, that didn't work. So we're still working on fine-tuning that clinic.
Okay. Now, Shirley, tell us about mental health, the mental health component in Lutheran Family Services' role.
Lutheran Family Services will celebrate 125 years in Nebraska this year or next year. They've been in Lincoln for over 40 years. We provide behavioral health services, children's services, and community services. And the behavioral health services include individual mental health counseling, family counseling, substance use treatment, just a wide range of services that clients might need. We know that clients that don't have regular primary care die 25 years sooner than those that do have regular primary care. So the idea of a primary care clinic with the behavioral health just really made sense for our community.
So Brad, what is People's Health Center's role in this?
So People's Health Center, we're a federally qualified health center. What that means is that we receive federal and state dollars to provide care for the uninsured and underinsured. Primarily we have a little over 10,000 patients, and about 34% of those have no insurance or are underinsured. A lot of the times when you have a large population like we do, you're going to have some behavioral health needs in the patients. And so this has been a great opportunity for us because we have been doing primary care, we specialize in primary care, but we haven't always been able to have that behavioral health interaction. A lot of times when our primary care providers have a need for behavioral health, they have a question about a med. Maybe they want to start them on a med for heart disease, but they've got these behavioral health meds. Just trying to find the provider and get back to them in a timely manner, has been difficult. And so now that we have this partnership with Lutheran Family Services, we can contact them, we can ask them questions. We just are in the process of hiring a psychiatric nurse practitioner who can help, make our PCP team a lot more well-rounded. And so when we were asked to do this with Lutheran Family Services, we kind of jumped at the opportunity, and thankful to Community Health Endowment for allowing us to partner with them on this.
Okay, good. And now you've mentioned docs and some nurses. What sort of staff is on staff there?
So we have 1 physician, we have 2 nurse practitioners, and then we have an assortment of nurses and medical assistants. We've got a full-time interpreter, as well as a social worker that we call a behavioral health consultant. and the behavioral health consultant's role is to support the primary care team. So they're not doing your traditional 50-minute therapy sessions. They're actually there to help support the patient in whatever they need. A lot of times you'll go to a doc and you don't really understand the diagnosis that the doctor just told you, but you're afraid to sound like you don't know, and so you just kind of go on. But if the provider or the nurse, feels like, maybe you need a little bit more education, or maybe you just got hit with a heavy diagnosis. Let's say you've got cancer, or you're a new onset diabetic, and this is just really heavy news to you. That behavioral health consultant can kind of go in there and help talk about the options, talk about the alternatives, and then just kind of figure out where they need to go in their mental health state. Do they need to have, some 3 to 5 therapy sessions, just so they can understand their disease a little bit better? Do they need to see, a therapist ongoing to deal with some issues? And so the behavioral health consultants, they're in a variety of ways, not just doing the traditional therapy, but just trying to support that patient.
Okay, very good. What sort of feedback have you had so far from patients?
It's been very positive feedback. The clients, really like being able to come into one door and be able to get a lot of their needs met. We also have a full service pharmacy on the campus, so that clients can come in, they can see their doctor, they can pick up their prescription. If they're seeing therapists on the Lutheran Family Service side, which is where the partner comes into place, if they do need longer therapy, the behavioral health consultant can walk them over to the Lutheran Family Services and help them make an appointment, and a lot of times that's a lot less threatening. If you've already been through one door, you know who the front desk staff are, and it's a lot more easier. It's easier to come in and get your therapy then. And then also they can use the pharmacy to pick up any prescriptions that they have.
Yeah, and that's one thing nice about our building. We designed the building to provide wraparound services for our patients. So when you walk in, you go up to the front desk and you don't really know, the other patients in the waiting room don't really know which side you're going to. You can check in, and then everybody goes in one entrance, and then when you get to the end of the hallway, you split to go to the primary care team, or you split to go to the LFS side, and then everybody goes out the same door. And when you go out, you go right past our pharmacy, our Genoa pharmacy that's in that building. So if you get a prescription during your visit, you can stop at the pharmacy, get it filled, and then it's kind of a one-stop shop for our patients.
Yeah, that's great. So I hear there's going to be a new Head Start program going in as well. Tell me more about that partnership.
Community Action has partnered with us. There we'll have 5 classrooms in the new addition part of the building, which will be about 5,500 square feet. They're expected to open around October, so we're excited to have them as a partner.
Good. So what have been some of the challenges for your organizations?
Well, I think the biggest thing is, bringing 2 cultures together. Primary care refers out to a lot of specialties. Behavioral health is a specialty, and so in the past we've always just referred out. We see the patient and be like, oh, we can't take care of this, we send you somewhere else. Well, now our team has to get along with staff that we don't know much about, with the LFS side. Plus, behavioral health and the primary care team is kind of a mystery. We deal with it. We have dealt with it for generations. We've prescribed medications for it, but we don't really understand it. And so the biggest thing is, now that we have social workers in the clinic, it's getting used to how do we use those social workers. How do we use their expertise? How do we use the expertise that Lutheran Family Services brings to the table? And we're still, we're about a year and a half into it, and we're still learning. There's still a lot of things that we could do better, but we are, the feedback that we've gotten so far is it's working. We have, a lot of patients that have a dual diagnosis of mental health care issues as well as primary care issues. And the providers are seeing a difference, the staff are seeing a difference, and the patients, if they're not admitting to it, their families are seeing a difference. And so that's kind of the biggest thing for us is getting along in that behavioral health realm.
Now, who's eligible to use Health 360 and how do they get a hold of you?
Anyone can come to the clinic. We take Medicaid, Medicare, commercial insurance. If you do not have any insurance, we will help you through that and offer a sliding scale if you can't afford to come. Really, if you need health care, please call us at 441-6642 and we'll certainly, help you figure out a way to get into the clinic.
Very good. Thank you both for joining us and good luck with this great partnership.
Thank you for having us.